Hello and welcome to another episode of the Powered Hormones Empowered or Powered Hormones, I guess that works too. Powered Hormones podcast by Sheradyn Dekker. You're welcome. It's great to have you guys here. I'm super excited for today's episode not because I love UTIs, don't get me wrong, that's not a viable something I'm about, but I do get asked this question a lot, so I'm really excited to be like, hey, go listen to episode 147 Natural UTI Treatments with Sheradyn Dekker. And everything you will need to know about UTIs is in there, which is great because often I get quite regular sort of questions in my DMs about UTIs, BV, thrush, constipation, bloating, heavy painful periods, missing periods, macros, weight loss. So all that general stuff, fatigue, that's another big one, low libido, all those general things that you guys really struggle with. I try to do podcast episodes on. So if you do ask me a question on something, I will try and make a podcast episode on it because the reality is, and I always tell this women inside the Root Cause program, the reality is if you've got this question, and there's something we hear all the time, someone else has had this question, got this question, or it's been answered before. So inside the Root Cause program, I get the women to post their questions in the Facebook group. So we've got an awesome Facebook group. It's got heaps of guides and information in it. It's got an awesome little search tab bar that you can go through and go, cool, UTIs, thrush, bloating, constipation, what did Sheradyn say again? Run through those main tips, tricks, things, or ask me in the group calls, or ask me in your one-on-ones, or go, what's going on? Just gives a community feel, but also because there's so many women struggling with so many similar things, which is why you're working with me, because if you had no struggles, you would simply not be in my program. Then other women who've struggled with similar stuff can help you, but also you can see how we've combated it in other cases before. And like I said, UTIs is a really common one because A, they really suck. B, they're kind of like BV and thrush in the sense that they can be reoccurring, but also there's different treatment options for them. Same in the sense of BV, you can go down the antibiotic route or the natural route, which we will jump into today. But having a random UTI infection really sucks. It's really uncomfortable. If it gets out of control, it can get quite serious and then get obviously more exacerbated, and then you really do need to take antibiotics for it. Long-term treatment, you are looking at root cause stuff, so that's where stuff like your vaginal microbiome swab to look at bacterial strains, your stool testing to look at immune function, those kinds of things are really important to sort of go, okay, cool, why do we have such a low immune system? Why do I keep getting sick? Why do I keep getting UTIs? Why do I keep getting recurring infections? Because we really want to understand what's going on with not only your gut, not only your vaginal microbiome, but your overall immune system, and then your overall cortisol response, your adrenal function, and everything else, because we just simply cannot address one without the other. But short term, you need answers, which is why you're here today and why I'm here. So what actually is a UTI? So UTI stands for urinary tract infection. So this occurs when there's an infection caused by bacteria. So mainly Escherichia coli. So this is responsible for about 80 to 85% of all UTIs, sort of UTI infections in a sense. So this is the bacteria you're typically looking for, and this is what's going to cause this issue. So UTIs are painful, but they do make themselves known through quite distinct symptoms. So it's a bacterial infection that starts in your urethra and your bladder, and then it spreads to your kidneys if it becomes more serious. So these are the symptoms you are looking out for. So burning sensation when urinating, frequent urination, cloudy urine, bloody urine, constant urge to urinate, strong smelling urine, pelvic pain. So they're kind of your main ones that you would get. And there's a spectrum, right? Like anything, it'll start with this sort of lower end infection, and then it will gradually get worse and worse and worse if symptoms persist or your immune system or treatment doesn't get on top of it. Now, if your infection has spread to your kidneys, you may experience more severe symptoms. So things like side pain, high fever, back pain, nausea, vomiting, chills, all those kinds of things. show up when these infections have spread. So if it's left untreated and it comes into a kidney infection, then that can result, like I said, in severe health complications, and you do want to treat that ASAP. But if you pay attention to your symptoms, you listen to your body, then this is not very likely that's going to spread to your kidneys. So just be aware, like if you are getting fever or more severe symptoms, you do definitely want to go and see a GP ASAP. Now, certain characteristics will put you, or certain factors will put you more at risk of a UTI. So your female anatomy is one. So your proximity of your urethra to your anus and vagina, so that short length will, because there is a lot more bacteria moving around there. Which is why like vaginal swabs and stool samples are an important part of this picture, because if there's a lot of opportunistic bacteria moving through, that is something that's going to increase your chance of infection. Poor personal hygiene is one, pregnancy is one, postmenopausal women or women who aren't menstruating or like have a really low hormonal picture. So this estrogen deficiency and thinning of the urethral mucosa is something that can impact it, because we know that estrogen normally maintains vaginal flora. So low estrogen dramatically increases or supports the microflora from one dominated by lactobacillus. So the estrogen supports that lactobacillus. So when you're taking like Biome Her or a women's flora blend, it's predominantly lactobacillus blend. Whereas if you don't have a good number of lactobacillus, then that E. coli can take over, okay? So you really want to support good estrogen levels, good lactobacillus, and minimize your chances of an infection. And this goes across to a BV, thrush, anything. You need to have a nice, healthy vaginal flora, which I've done a lot of podcasts on that as well. Other things, the use of a diaphragm, compromised immune system disorders, antibiotic use, birth control use, not enough fluid, and then use of irritant chemicals or contraceptive devices. These are all going to impact it, okay? So we know what our symptoms are now. We know how to identify if we've got a UTI. We know if we're at risk. So how are we going to treat these UTIs? This is what you guys actually want to know. So your GP, if you're suspecting, like if you've got these symptoms coming on, your GP or your doctor will just run a test, a urine test, to look for that bacteria, the E. coli. If you're diagnosed with that, usually your doctor will prescribe you antibiotics, okay, depending as to what bacteria strain you've got. Now, I've harped on about antibiotics. You guys know my thoughts on antibiotics. They can be necessary at times, but a lot of research shows there is overprescribing. So some research even says close to 30% of antibiotic prescriptions are unnecessary, while some reports claim that's closer to 50%. That is a lot of unnecessary prescribing. I'm not going to lie, like that's a really, really large amount. So if we're continually taking antibiotics, we're going to damage that good gut flora, okay? Because the antibiotics work by targeting and killing off bacteria, which is great when it comes to these pathogenic bacteria that we don't want, so the ones that are contributing to our UTIs or our BV or our gut infections. But the antibiotics don't discriminate, so they can kill all the good bacteria in their path as well. So this is obviously then going to impact your immune system and your overall health. So we really need to be conscious of our antibiotic use, or any medication use for that matter, because that's all going to impact that microbiome. So things like Panadol, Nurofen, Advil, all that stuff. Sure, it has good short-term benefits, but what is the long-term benefits, and what are other things we can swap out, like PEA or Boswellia or turmeric? They're going to help support inflammation without damaging that microbiome. So we want to know what's going to give me the greatest result with the least amount of side effects. So if that is antibiotics, because you've got a lot of the more severe symptoms, then sure, definitely time and place, and then work on rebuilding and restoring the vaginal and the gut microbiome. If it's not at that severity, there's a lot of natural treatment options. So I'm going to run through some of them now. So I will cut out gluten, sugar, dairy, alcohol, and just check your water intake. So 3 to 4 litres of water per day. Just check for BV as thrush, just in case we also want to tie in treatment for that. I would recommend vaginal probiotics. So I love the Biome Her one, but you can also get the Blackmore's Women's Flora one as well from Woolies, which is great too. Think about sexual hygiene because that's going to aggravate the overall condition. Cranberry tablets can help with UTI. I'll go into that in a little bit more detail. D-Manos, which you can find on iHerb as well, that can help for the bladder. MCT oil can be beneficial. Just be careful because it can cause loose stools in high doses. You can also, for Candida, BV, or UTI, or even to use as a lube, there is a product, coconut. It's coconut oil suppositories, but the brand is Puro 3 ozonated oil. So PURO3 ozonated. So OZONATED ozonated oil suppositories, which can be really, really helpful as well. There's some cool research on that stuff too, so just check it out for overall health benefits. Cranberry juice, so 300 mils a day, that'll decrease or inhibit the growth of E. coli. Fresh garlic can be really, really beneficial. Now, as far as more specific supplements, there's one from Thorne called Uristatin. So this contains uva, I always say this one wrong, uva, osari, echinacea, berberine. So some antimicrobials that are going to help kill off these bacteria and stop unwanted bacteria from attaching to the walls of the urinary tract, and then also soothe the tissue. So you want to take these 3 capsules 4 times a day. Check with your healthcare practitioner first, please. Make sure it doesn't interact with other stuff that you're taking. But usually you do around 7 days of this. So that's Uristatin by Thorne. So that's a really good product. So if you're doing that and you're doing like your 300 mils of cranberry juice, or you were taking cranberry, so 1,000 milligrams 3 times a day for 7 days, can be really helpful as well. So that's cranberry tablets. And then the other one I really like is D-Manos. So this inhibits bacterial adhesion to the lining of the urinary tract. So this again stops the colonization of that infectious bacteria. 2 grams twice daily for 7 days is sort of for an active infection, or 1 gram daily for prevention of infection. So that's your D-Manos, so D-MANNOSE. So your D-Manos, your cranberry tablets, and your Uristatin are all really great products, as well as cranberry juice, your probiotics, your garlic, your MCT oil. Checking your diet are all going to be key components in getting rid of and reducing your chances of infection. If you have ongoing immune symptoms, definitely think about supportive herbs like olive leaf and like echinacea to support that immune system as well. If you have done a stool test and you know you got low sig IgA, which is a marker for immune response, you can also throw in something like Saccharomyces boulardii, which is going to be really beneficial for that low sig IgA. So I hope that's beneficial. There's a lot of information in this short podcast episode for you. If you've got questions on any of those supplements, please reach out, but you can find most of them on iHerb or a reputable supplement store or chemist. Usually like a naturopathic place will stock them for you, but get your hands on some of those so next time you got a UTI, you can just jump on it straight away and don't have to end up taking antibiotics. Would love to hear from you guys. Please reach out, Sheradyn_functional nutrition. Flick me a DM. I love chatting to you in there. You can join my Facebook group, Gut Health Solutions. I post a lot of great content in there, things you can learn from. Stuff like this ends up in there as well. So you've always got a reference point if you do get unwell, we can post and they'd be like, hey Sheradyn, got a UTI. What episode was that? And I'd be like, cool, 147. I won't remember that, but I'll be able to find it and tell you. Otherwise, have a fantastic start to the year. It is the 3rd of January today, so we're 3 days in. I hope everyone had an awesome Christmas and New Year's break. I certainly did. It was so good to just be able to work on some business stuff and some creative things, and to get out of my usual go headspace, do some extra writing, which was super fun, get down to the beach, walks, and yeah, just enjoy being alive in a beautiful part of the world. So I'd love to hear from you guys. Please reach out. Please rate and review my podcast. That would mean the world to me. Otherwise, I will see you around on the gram.